Hi, Brandy. For the first question of was I satisfied with my ability to evaluate and treat your assigned patients? So the two patients that I evaluated and treat, one was Courtney Rogers with the abdominal pain and positive drug test, and the other one I treated Joyce Booten with the GI bleed, and I think that I definitely had a more difficult time with Courtney Rogers, just because like I went in there thinking, okay, I want to do an evaluation, I want to practice using DocuLearn to bedside chart, and then as I got in there, I was like, okay, this isn't, like a hip problem or a cardiovascular condition, and it was more, I think, mental health in a way because of the drug and alcohol use, and so I felt like the evaluation didn't need for me to ask like, oh, do you have stairs in your house? And do you have adaptive equipment? Like most of our sims usually have us ask those kind of questions. So that was challenging. I didn't really think that through before I went in there. Yeah. So that was a challenge for me. But I tried to just ask her questions more around occupational profile, and I was able to gather a lot of information through doing that. And like the whole time I was talking with her, she was moaning and groaning in pain. And so I tried to sympathize with her, and I told her that I had read in the chart that she was going to be getting a morphine drip in 30 minutes to help with her pain. The nurses would be able to talk more about that with her. So I felt like I used like that collaborative aspect by like relaying information to her about like what the nurses could do to help her with that, with her pain. But I think I was just proud of my ability to kind of alter my thought process while I was in there. On top of her just being really upset to begin with from her pain. And so yeah, I liked that I was able to build the occupational profile and do something different than what we usually do in the acute care setting, with like how I was talking about using section GG and evaluating more of like their motor and fine motor abilities. And another challenge I had with her was I was trying to think back to mental health when we learned about the motivational interviewing. Obviously that's more of like a treatment type thing, but she told me that she drinks alcohol consistently every night, and so I don't know, I was trying to like make her realize that, maybe that wasn't a good choice, but I didn't want it to make it sound like I thought that that was a bad choice and that I was like putting her down for it, because I don't want my patients to think that I think they're a bad person. I just want them to think that I want what's best for them, and they need to realize themselves that it's not a good choice. So I kind of struggled with that, and I think that's something I could work on. Just trying to find the right words to use with patients who are dealing with touchy subjects about like alcohol and drug use and life choices. Because everybody has their own opinions, and I don't want to reflect my opinion on theirs because they might not agree with it. So yeah, just that motivational interviewing aspect I think I need to work on, but I was proud of my ability to get a lot of information from her about her life and her job and like her daughter. And then I communicated with a social work and told the social work student who was on her case that, you know, she is missing, she's not in work right now because she's in the hospital. She works at Walmart, and her phone was dead and she didn't have a charger. And I told her, like, if you can, you should see if somebody can bring you a charger so that you can let your work know that you are at the hospital. Because, you know, job stability is very important. She needs to do her best to try to keep her job, and if she's just not coming into work and is not showing up, and she didn't tell anybody why she isn't showing up, but she has a valid reason to miss, you know, she could get fired for something like that. And then I like talked with social work about her daughter, and the social worker was thinking of maybe looking into Child Protective Services going to visit, just because the mom goes and drinks and lets her kid just like go down to a friend's house down the street, walk there by herself, so the mom can go out and drink. And she didn't feel that was a good, like, stable environment for the kiddo. So I thought that was good, collaboration. And then with Joyce Bunton in the GI bleed, I went into the room and did a treatment session with her, and I kind of challenged myself again to think on my feet and like analyze the room and see what I can do quickly. And so with her, since I didn't know like her physical abilities before going in there, I just wanted to make sure that she was going to be okay with getting up and walking, especially since she was in acute care. So I did a quick range of motion and medium muscle testing, and I don't know if that was the correct thing to do, but it was good to practice. I even did just like the strength testing on her legs, and I hadn't done that before. So I had her get up and put the gait belt on her, and she said she had been up and walking, and she wasn't a fall risk, so we didn't use a walker. And I had her make the bed, and I had her wash her hands. But I was able, I mean, I could analyze and find out a lot of information through just doing those two things. And she wasn't very talkative, but I was able to get some information out of her. And then I talked with social work, who on their chart it said that she abused alcohol, which I didn't know that. That wasn't on my chart, and I didn't talk to her about that. So found that out from social work. And then I told social work and nursing a couple of things that she had told me that they didn't know, as far as like her job, and if anybody would be able to be at home and take care of her when she goes home. They didn't gather that information, and I had, so I let them know about that, especially social work. And yeah, so I felt like that one was okay. I feel like I could have done more with her if I had have thought of a plan quicker, had more OT experience of working on the fly. But having her make the bed and practicing range of motion and assessing strength was good practice. She didn't have, I was gonna have her wash her face, but I didn't have a rag, so we just did hand washing, and I thought that was okay. Definitely could have done more with her, but you know, I learned. And then let's see here. What did I learn? I think I learned a lot that the patients that I'm gonna see in acute care, aren't always going to be a hip replacement or CHF, or neuro-based. Like, they could be somebody who abuses alcohol and abuses drugs and is maybe having abdominal pain because of that, or maybe because of something else. But that my clients aren't always going to be something that's like motor based or fatigue based in acute care. And I think I just never thought of that, really, that patients could be something else in acute care. And kind of feel stupid for not thinking that. But I mean, those are the only kind of patients that we do in our sims, so I just thought that's your typical patient that you're going to see in an acute care setting. So it was good to challenge myself just to talk with patients that have different types of situations going on, and gather information more so about their life than how their problem or impairment is affecting their life. And I think also, like, I especially with Courtney, I could have done like an assessment, probably one that we learned in mental health that I can't think of right now, but just to evaluate how like her life choices impact her life outcomes. I think that would help her realize like her choices like not only affect her but her kid. And yeah, and I think that would like help go along with the motivational interviewing piece that I was thinking about trying to do with her, but I just didn't want to like overstep and potentially blame her for her choices. So I know I need to work on practicing that better. Were you satisfied with your communication with the interprofessional team? If so, what did you feel you did well? If not, what would you do differently? I think I communicated well with them. I talked with social work a lot, and I did talk with nursing as well. When I was in the room with Courtney doing her evaluation, nursing had walked in and took vitals. And so we kind of just like paused on me for a couple of minutes, and nursing took over and did her vitals. And then once nursing left, we said goodbye, and then I took back over talking with Courtney. And then when I was in the room with Joyce, nursing knocked on the door and I had her up and was at the sink. So nursing was just like, okay, I'll come back in a couple minutes. And by the time she had come back, I had gotten her back into bed and was about to leave. I was just talking with her. And so nursing came in and I updated nursing about our session and how she was doing, and told her I had her up and walking and that she was doing great, and that she had thrown up, but said that she wasn't feeling bad. She just told me she wasn't in any pain. So I kind of communicated like the current status of the patient to nursing when she came in the room. And then I talked with social work about the two clients that I had. There's two different girls. One of them was on Courtney's case and one of them was on Joyce's case. So I talked to both of them and they told me about their audit that they did with those two clients, that was about their alcohol use. And that's when I found out about Joyce's alcohol use. So that was good to know. And then they kind of talked to me about their plan, and what they talked with those patients about, which I thought was interesting to learn. They said that they talked to them about, especially Joyce, like discharge, where she should go. And I had told I had told social work that she didn't have any family in this state, and the closest relative was in Florida, and it was her daughter, but she was busy with her kids. So that led social work to think that maybe an inpatient rehab facility would be best for Joyce to help her with her alcohol use, an inpatient place, just because she doesn't have family nearby to kind of keep her on track, and make sure she attends meetings and things like that. And then what would you do differently if you could repeat this simulation experience? What would I do differently? I think that I think that I did well, and that I challenged myself to try new things. Probably differently, I think that I would do more in the room with Joyce. And I think that I would do some more research prior to seeing the clients about alcohol use, and like the effects of alcohol use, like if it could cause a GI bleed, or the abdominal pain, and learn more on how to talk with those kinds of patients, just because it's a touchy subject, and like I said, I don't want to overstep and put blame on them. So yeah, it was a good time, and I think one of the bigger takeaways, I remember leaving the center, and I was talking to Grace, and I was like, I felt like nursing was just like running around like crazy that entire time. And I saw my 2 patients. Well, actually, Grace and I went and did range of motion with one of the other patients as well, and talked to, it was a mannequin, so it wasn't really range of motion, but we attempted range of motion. But we talked to the wife that was in there at the time. I can't remember who it was. Let me look. It was Emery Jensen. No, it wasn't Emery Jensen. It was Manny Rivers. No, it wasn't. Okay, I'm sorry. Who was it? Oh, it was Harold Hote. Yeah, it was Harold Hote, with pneumonia, and he had the trach. And I did the sponge in his mouth. I can't remember what that's called, but the sponge, to clean his mouth when you're in PO, that we did in class. And it was nice to talk with the wife, and she was really down. She was a really good actor at being down and sad about the situation. So Grace and I tried to comfort her and talk to her about a social support group, either here in the hospital or online, because she said she couldn't leave him, and she didn't want to leave him. So we talked about like a Facebook group online that she could talk to, just to have somebody to vent to, because that's always good, just to have somebody to lean on and tell your story to, just to get it out. And yeah, the range of motion was interesting because he didn't have an elbow joint. So I was like pushing up his arm, and then I raised his arm up, and then worked down to the wrist because didn't have an elbow joint. But yeah, it was a good experience. Crazy to see nursing running around like that. No wonder they get very tired after their shifts. It was cool to see nursing work together during the code. The charge nurse was telling them what to do, and to resume compressions or stop compressions, and was counting. And it was also cool to learn about like the dynamic of the nursing group with the secretary and the charge nurse. I didn't know anything about that. So yeah, everybody was really nice. Social work was really nice. We talked to them a lot because nursing was really, really busy. But yeah, it was good.